So here we are talking about what works, and the first area that we're going to discuss is that treatment. Treatment works. Treatment for addiction, substance use disorder works. And we know that using the medical model that we had discussed, treating it as a disease, treatment works. And that's one of the areas that we're going to explore now. This is from the Office of Addiction Services and Support. And we're just going to talk about treatment, but the variant types, the different types of treatment. There's different levels of what we call levels of care, but there's different types of treatment. So we're just going to go over them here quickly. So the first one is crisis services, and this is also called detox. It's medically necessary where someone has to be in a detox, a medical hospital, a medical setting, 24-hour nursing and doctors, because individuals can go into convulsions, have seizures, and die. So just read this section here about the detox services. And I'll read along with you in silence. So an individual can stay in a detox for 3 to 5 to 7 days. It's very expensive, and insurance companies want to get someone out as quickly as possible because a hospital bed costs about $2,500 a day. So if someone is stabilized, medically stabilized, not having convulsions, not having seizures, and the withdrawal symptoms, the shakes, the shivers, the fever, the flu-like symptoms have passed, and someone's stabilized, then we can go on to the next level of care, which is called inpatient rehabilitation. Inpatient rehabilitation, or an inpatient rehab. Inpatient programs provide a safe and supportive setting for the evaluation, treatment, and rehabilitation of people with a substance use disorder. And here you see that they're using the correct term, substance use disorder, but it's interchangeable with addiction. These facilities offer 24-hour a day, 7-day-a-week care that is supervised at all times by a medical professional. Inpatient services include intensive management of symptoms related to addiction and monitoring of the physical and mental complications resulting from substance use. So these are inpatient rehabs. Now, they usually go for 28 days, 28, 30 days, if we can get the insurance companies to agree to that. But you're going to get at least 14 days out of it before, as I mentioned before, they have to do this utilization review. So it's not as expensive as inpatient hospital. It's a rehab where individuals go and stay there, and it's a full day's program. It starts from the moment you wake up. They'll usually do a morning meditation reading, and then there's breakfast group. You have assigned a primary counselor. There's group therapy, education, individual therapy, 12-step meetings. There's meals. It's really a full day. You stay on the grounds. You don't go out. You're not allowed visitors, although people can come on weekends as part of the family program, but there's a family component to it, so visitors have to take part in the family program. Now, there are more than just a few inpatient rehabs on Long Island, and we're going to get into that a little bit more. So an individual can come from a crisis center, a detox, hospital-based detox, where they're stabilized and drug-free and physically stabilized, and then they would go to an inpatient rehabilitation to stay for like a full day, 24 hours, 7 days a week care. If you can get 28 days out of it, that's even great, but 14 days of really intense treatment. Outpatient treatment. Now, there's more than just several. There's quite a lot of outpatient treatment programs on Long Island. As a matter of fact, there are 5 outpatient programs in Riverhead alone. So, outpatient facilities provide clinical services for people with an addiction to substances and their family who have been impacted by their addiction. Outpatient services may be delivered at different levels of intensity according to the needs of the patient. So when we say different levels of intensity or levels of care, when someone just comes from rehab, we can give them what's called intense outpatient services or intense outpatient treatment, which can be actually 5 days a week. But it's usually 3 days a week, but they're longer groups, and there's individual in there also. So it's 3 groups a week and an individual session, and the groups are longer. So with outpatient services, the individual is living at home or at his own place or in a sober house connected to the outpatient program, because a lot of times the family doesn't want the patient home yet, needs more treatment. So there are quite a lot of what we call recovery homes or sober homes that aren't regulated, but sometimes they're attached to an outpatient program, so they're a little more closely watched because they do urine toxicology screenings and drug screenings. So they're watched, but they can be out in the community, they can go to the stores, and they can go home, they can stay by themselves, and they come to the outpatient program as much as 5 times a week every day, or 3 times a week, longer groups. So the first level of care or the level of intensity is intense outpatient services. Then depending on how well they're doing in treatment, the services can be reduced to maybe 2 times a week or 3 times a week, or the groups are only 90-minute groups, or there's also evening groups for people who are working, or they can come 1 time a week, twice a week, or just for individual, depending on how they do in their counseling. But it's pretty intense also because there's counseling, education, and they're connected to the community. They're going to 12-step meetings, AA, Alcoholics Anonymous, Narcotics Anonymous, and they can stay in treatment for up to 6 months. So they go from detox to inpatient rehab to outpatient, and they could stay in outpatient for 6 months. So there's what we call a continuity of care. There's a continuum of care. It's, as you all know now, according to Dr. Montes, there is no cure for substance use disorder. There's no cure for addiction. So there's a continuum of care, and it's varying levels, but it could last for a year or 2 years, but then they go on and on and on and live a life of what's called recovery. They're in recovery then, but there's no graduation from a program. You don't go to an outpatient program and then after 3 months graduate. There's a continuity, a continuum of care. Okay. Okay, and here is the assignment for this week. You're going to go to the website, oasis.newyork.gov, and you're going to, across the top here where it says treatment, it says search all programs for treatment. Click on that, and it's going to take you to all the Oasis licensed treatment programs in New York State here, and they're all over. But we want to go to Suffolk County, so you're going to just choose Suffolk County. Here we are, and you're going to hit here, submit. So that's going to do a search and give you all the programs in Suffolk County, and here we are. And you're going to look through here. Oh, wow. Look at all these programs. Okay, so I want you to look through it slowly. Okay, so what you're going to do is you're going to select a program, and you're going to go to that program and find out about it. So I'm just going to give you an example of how that works. I selected this program here. You're going to go to this program, you're going to find their webpage, you're going to go to their webpage, and you're going to write out a paragraph of what type of treatment that they provide, where they are, who they are, inpatient, outpatient, but you're going to go to their website. So you're going to look it up, you're going to Google it, but I did it ahead of time, getting ready for making this video for you. So here is that program. So you're going to look at it and read about it, where they are, who they are. Oh, looks like a pretty nice program. All right, so you're going to respond in your answer in the discussion board about what program you looked up, what is their web address, and then you're going to tell us a little bit about the program, what they offer, what services they offer. Not this program, but you're going to find a program here in Suffolk County, do a little research about it, go to their website, and then in the discussion board, you're going to post the name of the program and their web address, and you're going to tell us a little bit about that program and the services that they provide. Group, individual, family, and the insurance that they take, and you're going to post that answer in the discussion board, which we are all going to read. And you are all going to read each other's about the information that they found about a program that they looked up, and we're all going to read about each other's program, and you're going to see how this works. And then sometime when somebody might need help, might need treatment, you're going to know how to find them a treatment program. Okay, so that's the assignment for this week that goes in for what works. And for what works, we're talking about treatment now. Treatment works.